Welcome to AETCM, the Emergency Medicine channel. Today we are going to demonstrate on how to perform a full body exam. Before going into the video, we have to know the difference between the rapid full body scan as well as the traditional full body exam. The rapid full body scan is a time efficient systematic review method which is helpful for the critically injured patients for identifying the life-threatening injuries quickly. Whereas the traditional full body exam offers a thorough head-to-toe assessment which is suitable for stable patients. The choice of between the two is purely based on the patient's condition as well as the urgency of the situation. Now we will demonstrate each and every step of the traditional full body exam. First step is to examine the face for obvious lacerations, bruises, fluids and deformities. Step 2. Inspect the area around the eyes as well as eyelids. Step 3 is to examine the eyes for any redness. For contact lenses, use a pen light to assess the pupils as well. Look behind the ears for any bruising, which is indicating battle sign. Step 5. With the help of the pen light, look for any drainage of spinal fluid or blood from the ears. Step 6. Examine the head for any bruising and lacerations. Palpate for tenderness, skull depressions as well as deformities. Step 7 is to palpate the zygomas for any tenderness, symmetry and inability. Step 8 is to palpate the maxilla for any deformity. Step 9 is to check the nose for any blood as well as drainage. Step 10 is to palpate the mandible. Step 11 is to assess the mouth as well as nose for any cyanosis, foreign borders, including loose or broken teeth or dentures, bleeding, lacerations and deformities. Step 12 is to check for any unusual odor on the patient's breath. Step 13 is to inspect the neck for any obvious lacerations, bruises and deformities. Observe for any jugular venous distension as well as tracheal deviation. Step 14 is to palpate the front and back of the neck for any tenderness as well as deformity. Step 15 is to inspect the chest for any obvious signs of injury. Watch for movement of the chest with respiration. Assess the work of breathing as well. Step 16 is to gently palpate over the ribs to assess any structural integrity and elicit tenderness. Avoid pressing over obvious bruises and fractures. Step 17 is to listen for the breath sounds. Over the mid-axillary as well as mid-clavicular lines, a minimum of 4 feels if you check the anterior chest. And if you are assessing in the posterior chest, make sure you are assessing at least 6 feels minimum. Step 18 is to assess the lung sounds of the posterior chest. At this point, also assess the back for any tenderness, deformities, So you have to log roll the patients only once. Remember, if you suspect a spinal cord injury, then use spinal precautions. Step 19. Look for any obvious lacerations, bruising and deformity of the abdomen and pelvis. Gently palpate each quadrant and look for any tenderness. Make sure you are looking for any rigid or guarding condition. Step 20. Gently compress the pelvis from the sides to assess for any tenderness as well as deformity. Step 21. Gently press the iliac crest to elicit instability, tenderness or crepitus. Step 22. Inspect and palpate all 4 extremities. Upper extremity, check for any bruises, lacerations, swellings in both hands. Also, assess the pulse and compare with the right and left hand. In the lower extremities also, check for any bruises, deformities, swellings or any presence of lacerations. Make sure you are checking the both distal pulses and compare the right and left lower extremity. Make sure you are checking for the sensory functions as well as the motor functions of all 4 extremities.